My name is Jessica Hextall and I'm currently in my third year of my Bachelor's in Nursing. I have chosen to focus this PowerPoint on violence within nursing and how it can impact the well-being of nurses and their work environment, including how it coincides and impacts patient safety. Violence within hospitals and healthcare facilities are a growing problem. Nurses are at the forefront of this escalating issue. An increase in the ageing population within Australia has seen patients with dementia and delirium contribute to the violence that is occurring within healthcare settings. Work-related stresses, social instability, drug and alcohol dependence are all common factors that fuel this growing problem. Violence in nursing continues to be a growing concern for nurses. Not only does it impact all nurses working within the field, but can have detrimental impacts for patient safety. This issue is a critical problem as it affects the well-being of nurses and places strain within the workplace. Patient safety is also compromised as a result of nurses feeling strain and fear within their work environment. Poor patient care can be associated with an unhealthy workplace. Furthermore, increase in numbers of adverse events to patients are common, highlighting that when nurses are under strain and unease due to the environment in which they work, patients are at risk and patient safety is then compromised. Patient-related violence on nurses has increased and continues to climb. The types of abuse that are commonly reported are verbal abuse, patient swearing and yelling at staff. Physical abuse is also seen, and nurses are faced with the psychological trauma that comes with having to endure these acts of violence. Symptoms of post-traumatic stress disorder, anxiety and depression, along with alcohol and drug abuse are common side effects that nurses are faced with when they have been a victim of a violent incident. Reports of chronic pain following a physically violent act are well documented and see nurses needing time off due to pain and discomfort. According to Lau 2004, nurses are at risk of high exposure to violence. Almost 60% to 90% have been recorded in nurses that work in emergency and mental health facilities. A study found that nurses are also exposed to violence in other critical areas, including midwifery, medical and surgical wards, highlighting that not only are emergency nurses and mental health nurses being victims of violent acts, but this issue is seen in all areas within health care settings. However, the highest rates of violent incidences towards nurses continues to be associated with emergency and mental health departments. Statistics and data show that from last year, violent acts have increased significantly. Overall, in Australia, 3,719 were recorded in 2016 at the end of the financial year. However, in 2018, this number had increased to 5,514, showing that the violence that is reported continues to climb within Australia's healthcare facilities. Common types of violence that nurses are being subjected to are verbal abuse and physical assault. Verbal abuse is seen to be the most common form of violence that nurses encounter on a daily basis. Swearing and agitation, yelling and threatening behaviour. Such violence can be seen from patients and family members. Physical abuse, including the use of aids and devices such as scissors, intravenous poles, have also been reported. Patient safety within healthcare can be impacted when nurses are working within an unhealthy environment. Nurses that have encountered violence from patients often feel fear and lose empathy for patients, therefore resulting in adverse events in patient care, including medications being delayed or missed, medication errors, an increase in patient falls, resulting in longer stays in hospital. There are several risk management strategies that are in place to alleviate and de-escalate violent attitudes towards nurses from patients and families. Debriefing after violent episodes with peer leaders and nurse unit managers can aid future strategy planning and reflection. Discussion and clarification of policy and procedures within the health facility and utilization of security guards when necessary are all practical measures that can be taken to mitigate the occurrence of violence within nursing. New South Wales Health has a zero tolerance policy in preventing and managing violence within the workplace. This document outlines the standards that need to be actioned when acts of violence occurs within healthcare facilities. This policy is a guideline for staff into ways of protecting themselves and minimizing the risk to patients and families, maximizing patient safety and ensuring that best care practice is being upheld. Nurses are at the forefront of healthcare, working alongside multidisciplinary teams. A nurse leader is vital in the ability to empower and support fellow nurses, plan and manage the delivery of effective patient care. Leadership within nursing allows for a supportive network and in turn a healthy workplace. Communication, discussion and planning from a nurse leader offers acknowledgement to staff that their concerns are being heard. An effective leader that can empower using techniques through training and education has been reported to be associated with staff that is more engaged and a healthier workplace. As a new graduate nurse, the 7 standards of practice are an essential part of how delivery is given and received. In turn, new graduate nurses allows effectively to provide therapeutic and professional quality of care to patients and their families. In the event of a violent encounter, it is necessary to be critical in our thinking and response methods, ensuring that patient safety is our priority, while also being mindful of our own well-being and safety. Reporting and escalation of the incident is documented and followed up as per facility policy and protocol. Communication and reflection on such experiences will also assist in the future, alongside continual education and training enabling positive outcomes on future violent incidences. Cultural safety and respect, ensuring ethical practice is provided, ensuring patients are respected and acknowledged. The content within this PowerPoint was formulated through nursing journals, literature review, and policies currently in place. The information was relayed in 3 learning styles: auditory, visual, and kinesthetic, to assist in educating and providing insight into the issue of violence within nursing. Violence within nursing is a current and negative issue that nurses are facing on a daily basis. As future nurses, we can empower each other to work collaboratively and with openness and respect to effectively tackle this issue together as one. Applying current research-based practice and reflection, as well as working in conjunction with our nurse leaders and peers, will ensure that proper management strategies are used and practiced, giving nurses the ability to provide effective nursing care while working within a healthy environment.